Welcome to Variations 4, the Neuro unit. In this video, we'll cover questions 1 to 3. Question number 1, what are the three components within the skull, and how does each compensate for increases in ICP? As you can see in this picture here, you essentially have three components in the cranium. You've got brain tissue, intravascular, the vascular system, so blood flow and the blood vessels, and the cerebral spinal fluid. So when intracranial pressure gets too high, each of these can try to compensate. The question is, how effective are they in their compensation? Some are more effective than others, but overall, there's not a whole lot they can do. Let's go through each one. What does brain tissue do to compensate when pressure in this cranium builds up? It could be building up because of cerebral edema. It could be building up because of bleeding. When the pressure increases in here, what does brain tissue do? All it can do is act like a sponge. And just as when you put pressure against a sponge and you're standing against a wall with it, the sponge changes shape and absorbs the pressure. That's all it can do to compensate. And as you can imagine, that's not a very good compensation mechanism. That's going to cause focal neurological deficits. In terms of cerebral spinal fluid, it can get shunted away into areas called ventricles in the brain. And that can decrease the amount of cerebral spinal fluid in the area. But that only has very limited efficacy. Intravascular blood flow. Well, the body can try to decrease blood flow to the area, or it can try to increase blood flow to the area if it thinks that's what's needed. And we'll talk a little bit more about that later. The point is, the body can control how much blood is sent to the area. The problem is, it's not always logical. This response is not always logical. And you're going to see what I mean by that in just a little bit when we talk about blood flow to the cranium under times of ICP increases. ICP is intracranial pressure. And so we've just covered question 1, and here again are the answers in written form. And there they are written. And so basically summarizing what I've just said. Question 2. What happens when these mechanisms fail and there's no medical intervention? Well, if pressure just continues to rise in the cranium, what's going to happen is eventually these compensatory mechanisms that we just talked about are going to fail because they can't do too much. And if that pressure just keeps on rising, the whole brain is going to start to get pushed in a downward direction towards an opening at the base of the skull called the magnum foramen. And what's going to happen first is the brainstem is going to get compressed against this magnum foramen. And as you know, the brainstem has systems in it that control the heartbeat, that control the respiratory system. And you could have what's called brain herniation by way of it getting pushed against the magnum foramen and eventually cardiovascular or respiratory failure, death. And here again, you can see the answer written out under question number 2 of the in-class questions, basically just summarizing what I just showed you in the picture. Question number 3, MAP, also known as mean arterial pressure, gives an idea of the perfusion status of a person. We're going to talk a little bit more about MAP later on. I mean, in general, you can think of it as blood pressure. For now, you can just think of it as blood pressure. That's what we've been talking about in this whole program up to now. And that wouldn't be incorrect. But we're going to dissect what MAP actually is a little bit later and maybe kind of get some new angles on that. But basically, think of it as blood pressure from now. It's a mean arterial pressure, which sure is definitely a function of blood pressure. So anyways, how does the brain compensate for increases and decreases in systemic blood pressure? Now, you sure have seen symptoms of this. You know you've had patients with hypertension, and when it's severe enough, you know, what are some of the symptoms? Headache, blurry vision, dizziness. You've had patients with hypotension. What are some of those symptoms? Could be headache, could be dizziness. All the same things. It could be changes in level of consciousness. But the question here is not asking about symptoms. The question is asking, underneath it all, what is the body trying to do to protect the brain? We're talking about the brain because it's one of those key organs that needs perfusion. What's the body doing to protect the brain to try and maintain the optimal amount of not only perfusion, but avoid increases in intracranial pressure? How does the body work with that? Well, let's look at that diagram again. Let's imagine we have, for whatever reason, increased intracranial pressure up here. Okay, now what we're talking about only applies to the cranial blood vessels. It's different with the body. You know how the body works in terms of blood pressure. You've had at least a year working with that. We're talking about something very specific here, and that's the cranium. If the body senses that ICP is too high up here, and maybe that's because there's overall hypertension all throughout the body, that could definitely be a cause. What's going to happen is the cranial vessels are going to constrict to try and limit the amount of blood that can enter the cranium, thereby trying to lower intracranial pressure. They will constrict, the cranial vessels will constrict to try and limit the amount of blood allowed into the cranium in the hopes of decreasing ICP. On the other side of things, if circulation, if say O2 is low in the cranial area, the brain needs more oxygen, or blood flow is just not reaching certain areas, or you couldn't say ICP is too low because that's not possible. And I'll tell you why. The therapeutic range for ICP is 0 to 15 millimeters of mercury, so you can't go below 0. You're not going to have a negative ICP in the head unless you guys attach the suction in the skull, which is just ridiculous to even, that's like a science fiction movie. So ICP would never drop below 0. So you wouldn't say ICP is ever too low. That's not possible. But if the brain was deprived of something and the body wants to increase blood flow to the brain, while we know the rest of the body might go into fight or flight, which is vasoconstriction, the cranial nerves will actually do the opposite. They will vasodilate to try and allow more blood in. And if we just take a look back at the questions we're looking at, number 3, you've got summarized what I just said right here. Again, hypotension might be a reason why the brain is starved of oxygen and nutrients. The brain's just going to simply cause cranial vessels to dilate in the hopes that that allows more blood to pass through. And I'm going to say right off the bat, again, just like the compensatory mechanisms we started with in question number 1, these have a limited capacity to help and sometimes actually cause more harm. But that is the natural reaction of the body. in terms of cranial pressures and cranial blood flow.